This is Dr. David Stoker in Marina del Rey. I'm a board-certified plastic surgeon, and I'd like to speak to you briefly about brow lift surgery. There are several different types of brow lifts that we consider. The first one is not really surgery at all. It's using Botox to one's advantage. You inject Botox along the orbital rim here laterally. In some cases, we can get a little bit of elevation for patients, which is quick, easy, inexpensive. It's limited in what it can do, but for most patients who are getting a little bit of Botox anyway, I love having the opportunity to try that for them, because for a lot of patients it can give them a little bit extra than what they were expecting from just a Botox or Dysport treatment. The next different types of brow lift we consider are endoscopic brow lifts. Those are where we have several little tiny incisions here, where we use endoscopes to lift up the skin of the brow here and mobilize it upwards and back. That's a good procedure for some patients who have a hairline that it's at the appropriate position. For those who have a high hairline to begin with, we wouldn't want to advance that hairline back anymore. So in those cases, we would think about making hairline incisions. So that's going to be right where the hairline is on those patients. Sometimes it'll just be in the temporal region on the side. It's again going to be customized, of course, depending on the particular patient's needs and their age. But what that will allow us to do is to lift up the brow to get it up off of the eyelids, in this case, for those who have a low brow. It's important not to lift it too much, of course, because that can create a surprised look. The older style brow lift that we used to perform more, now it would be less common to do that, but may apply in some cases, is a full-on, what we call a coronal brow lift. That's an incision all the way across the brow, full thickness, ear to ear, where we bring the skin down, weaken the muscles on the inside, lift everything back. It gives you the biggest brow lift improvement, but it's just a lot more surgery than most people need these days with these other minimally invasive procedures. The last thing that I would add to the brow lifting treatment is laser resurfacing. Laser resurfacing in combination with Botox or Dysport can really help to smooth out the brow in this area and give you some tightening. That's super beneficial for patients who have fine wrinkles and sunspots on their skin who are doing laser resurfacing anyway. This is Dr. David Stoker, board certified plastic surgeon, speaking to you about brow lifts.